us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right. So in today's video, we are going through who has responsibility for the healthcare system and how those systems work together to ensure that all Australians achieve a holistic health. So, touch wood, shorter video, never ends up that way when I say that, but let's try. So the first set of responsibility that we look at is the government. Okay, what responsibility does the government play in the healthcare of Australia? And hopefully you're all sort of like, well, the government plays the large responsibility, because they do. So we do have 3 levels of government. I've only got 2 on the screen at the moment. I'll rub this off and we'll go through the third in a minute. So our 3 levels of government, we have Commonwealth government, which is our national government, okay? We've got state, and then we've got our local governments. So looking specifically at the Commonwealth government, so they have the overarching responsibility for funding the state systems and deciding on policies, okay? The Commonwealth government will allocate funds to different state governments, and that's based on the needs of the states, the status of the hospital systems in those particular states, you know, because if one, for example, like just throwing numbers out there, if New South Wales has 1 million people in hospital and Victoria has 600,000 people in hospital, it's not equitable to give the same amount of money to both of those states. Okay, so obviously the state that has the greater need will get more funding. They will also create policies and decision-making for the states. So if you look back to like COVID-19 time, we were given basically, not we, the government, I'm not the government. The government were given a set of guidelines from the UN. That basically, these are the best practices for preventing and stopping the spread of COVID. The government then basically allocated a set of policies to the states in like a broad framework and said that you can choose to do this or this and this and this. So that's why when you actually got to the state level, what we did in New South Wales for COVID-19 was different from what Victoria did and was different from what Queensland did, but overall, they all were on the same theme and along the same line, okay? So the government gives those broad things, and then the state governments themselves make specific decisions for their own communities as to what's best. So the biggest examples that you can think of when you think of Commonwealth government responsibility, Medicare, the PBS system, public health initiatives which are nationwide, such as like the National Tobacco Strategy, and the main one being the allocation of funds to support said systems running in the states. So our next level down is then going to be our state governments, okay, and territory. State governments utilise the allocated funds to do the following. Operating public hospitals, okay, such as John Hunter Hospital, right, which is our biggest local one, the Mater Hospital also. So they are publicly funded through taxpayer money, etc., largely based through Medicare, so people can go to emergency department or get referred by doctors, etc., which we went through in yesterday's video. And that's all state run, okay. The doctors that work there most of the time are paid government funds because they are government employees, same as the nurses, the support admin staff, the equipment, the rooms, the beds, the actual infrastructure in the building itself. It all comes from state funding, which is allocated from government funding, which all comes from taxpayer money here in Australia. So that's why you pay your taxes. Targeted health promotion campaigns, right? So for example, and I gave you an example here of Slip, Slop, Slap. So Slip, Slop, Slap and sun safety is a national campaign that we do here in Australia in all of our states and territories. However, it looks different here in New South Wales than it does in Tasmania, right? In New South Wales, and specifically, and we'll get to this in a minute when we do local governments, if you look at our area of Newcastle, we get a heavy Slip, Slop, Slap message here because we have a large beach culture here in the area. Lots of people spending way too much time in the sun, myself included. So we have billboards up around town. You know, we get TV advertisements, we get radio advertisements. If you go somewhere like Tasmania, yes, they still have the Slip, Slop, Slap campaign, but it's not pushed as heavily as it is here, for example. Other things that the state governments utilise funds for, and there's a whole list of them, but obvious ones, mental health programs and campaigns, child and adolescent health programs and teams that work together to focus on certain areas of health that are of need in those states, okay? The state government also have a advisory body that carry out inspections to ensure that facilities are up to regulation standards, and they call this process accreditation, okay? So at any time, you can have people from the health system rock up at any health facility that's state run, and they carry out a inspection to ensure that the facility is maintaining accreditation. And if it's not, basically they give them, like if it's just a couple of minor things, they'll give them basically a rap sheet and say, we'll be back in, I think it's 2 weeks. 2 weeks to fix this up. Otherwise your facility gets shut down. And then, you know, sometimes facilities do get shut down, unfortunately. But most of the time they're easy fixes, because most of the time the state facilities actually have someone employed to be making sure that the facility at all times is up to standards. So that's Commonwealth and state. Rub this off and we'll do local. And then so finally we've got our local government. So you think of local government such as, you know, your community. So we are currently in the local government of Lake Macquarie. Newcastle is separate, but they are what we are referring to when I say local governments. So the local government responsibility focuses on community level health and environmental stuff, all right? So big ones would be sanitisation and hygiene. Okay, so think about, you know, your bins going out every week and where that rubbish actually goes, and make sure that it doesn't impact on the health and well-being of you and I. Hospitality standards, so local restaurants making sure that food standards are up to scratch so people don't get an outbreak of like salmonella and stuff. Community services such as Meals on Wheels, which is a massive one which you already spoke about in our aged care video. So those are all run by community. You know, Lions Club would be another one, which is community run and owned. And also community-centered health promotion, okay, and e.g. fun runs. So communities, local community and governments can run certain campaigns specifically for the needs of that local community, right? And here in Lake Mac, they have a fun run around the lake, not all the way around the lake, but it's like from, I think it goes from Spears Point round to Toronto and back again, you know, to encourage healthy and active lifestyles. Or they also do one on the family track as well. So that's our local government. Now we'll do the non-government sector. Okay, so now we're looking at our non-government responsibilities in healthcare in Australia, right? So first of all, you need to understand that they operate independently from the government, okay? So the government does not fully fund these systems. However, the systems still must comply with the policies and standards that are set by the government. So private facilities can add extra standards and extra policies, but at a bare minimum, they still must follow what the government says the service needs to deliver, okay? So there are two sections that we're going to look at here. We've got our private sector for-profit and we've got our non-for-profit. So our private sector or for-profit sectors, they reduce pressure on the government sectors, all right, via private hospitals, dental services and other private clinics, okay? These are good things. Yes, you need to pay for them. So some people sort of see them as the enemy because you've got to pay for it, whereas opposed to the public hospital system you don't have to pay for. But remember, people that do use the private sector, who do have the money to do so, are freeing up a bed in the public system for someone who doesn't have the money to do so. So it is a win-win, okay? However, the businesses and services that are in the private sector do run for profit, which means that consumers pay extra out of pocket for the services, and there is a group of stakeholders or shareholders who do gain profits from running the sectors, okay? People aren't doing this out of the goodwill of their heart. They're doing it to make money, all right? Now, once again, that sounds really mean, but it's not, because if you are paying extra for a service, then you can almost guarantee that that service, well, you can't guarantee it's going to be better, but you can guarantee that there are certain standards that are going to be applied and that you will get very good care. Because if you had to pay for a service and that service was no good, why would you pay for it? You wouldn't. You would go do the free thing. If I can choose between paying for something or take the free thing, and the paid thing is worse than the free thing, you would never use the paid thing, all right? So that's All right, so you can sort of see that a lot of people who can access the private sector do it because they generally have good experiences in doing so. Okay, I've had quite a few surgeries over the last few years, and mostly all of them have been through the private sector, and I have nothing bad to say about them. I have nothing bad to say about the public sector either. I just personally haven't used the public sector in quite a while, and touch wood, I won't be using it for quite a while. So common examples would be like the Ramsay healthcare system, which I'm sure you've all probably heard of, you know, offering day surgeries, clinics, etc. Locally, we've got at Newcastle Private Hospital. We've also got Lake Mac Private Hospital, which is good. Funny thing, Lake Mac Private Hospital do run a emergency department, so you can go to them if you have an emergency, but you need to pay an out-of-pocket expense. I think it's like $500, right? So when my daughter got really sick one night, and like we live really close to Lake Mac Private Hospital, it was like 11:30 at night, and I'm like, okay, she's really sick. We can either go to the John Hunter and, you know, wait around for hours and hours and hours, or I can go just down the road and be seen with like in 20 minutes. And yes, it cost me $500, but it was money well spent because sleep is very valuable. I love sleep. Anyway, back to it. Finally, we've got our non-for-profit healthcare systems, okay? So they're generally run by charity groups, religious groups, community groups, etc. You still have to pay for the services, okay? Or there is still money that has to be allocated somewhere, okay? They don't run for free, okay? But any funds or any profit that is above, you know, the wages and the facilities and all the stuff that is it takes to run a business is put back into the business to further the running and further the research and education. Okay, so it basically runs at an even keel. It is funded by consumers, also public donations, so people will do fundraising to fund these certain services. And the government will offer partial support to these services if they're offering some primary care benefits. The non-for-profit healthcare system is usually based around education, research, and awareness-based stuff. So you can think of like public health approaches. And common ones that you would have heard of, Cancer Council, Beyond Blue, National Heart Foundation, which is obviously focusing on cancer, mental health, and cardiovascular disease, all right? So these things are actually non-for-profit, non-government organisations that do their best to try and improve the health status of Australians. So I'll rub this off, and then I'm going to just give you a brief overview of how the sectors all work together to make sure that we're all healthy. All right, so how does this all tie together, all right? So we know that the Commonwealth Government uses taxpayers' money to fund state-run hospital systems. The private sector will provide alternatives to those that can afford it, which then reduces the burden on the state systems. The non-for-profit organisations will advocate and conduct research towards certain burdens. The Commonwealth Government will also support them financially to run community awareness programs, which therefore will reduce the burden on the state system because people are no longer going into the hospital system because of, you know, things like lung cancer, skin cancer, etc. And finally, the state and Commonwealth governments will provide inspections regularly to ensure that all levels of healthcare, whether it's state, profit, non-for-profit, etc., all services and facilities are compliant, guaranteeing uniform safety and quality. So no matter where you are in Australia and what type of service you are seeking or that you need, you are going to get the quality care that you need and deserve to get better. And that will end our video on the responsibility for the healthcare system here in Australia. Thanks.